stuffy nose that just isn't getting better. You might have a sinus infection, also called sinusitis. Welcome back to VitalityVortex, your go-to source for health information and insights. In this video, we will talk about one of the most common types of upper respiratory infection, which is the inflammation of sinuses or sinusitis. Its common causes, risk factors, symptoms, and of course, treatment options. Later, we will also explain in greater detail why we usually do not recommend taking oral antibiotic right away for acute sinusitis. So please join us and keep watching until the end of this video. Sinusitis, commonly known as a sinus infection, is an inflammation of the sinuses, which are hollow cavities in the skull that are connected to the nasal passages. When these passages become blocked due to inflammation, fluid buildup occurs, creating an environment where bacteria, viruses, or fungi can thrive. This often happens following a cold or respiratory infection when the nasal passages are already irritated and swollen. It is important that we know our risk factors, which significantly contribute to the increased likelihood of developing a sinus infection. Let's delve deeper into each of these factors. Previous cold. Having recently experienced a cold can make individuals more susceptible to sinus infections. This is because the common cold often leads to inflammation and congestion in the nasal passages, which can obstruct normal sinus drainage and create an environment conducive to bacterial or viral growth. Seasonal allergies. Individuals with seasonal allergies, such as hay fever, are at an increased risk of sinus infections. Allergic reactions trigger inflammation in the nasal passages, leading to congestion and impaired sinus drainage. This can promote the accumulation of mucus and facilitate the growth of bacteria or viruses. Smoking and secondhand smoke. Smoking tobacco and exposure to secondhand smoke irritate the respiratory tract, including the nasal passages and sinuses. This irritation can impair the normal functioning of the mucous membranes lining the sinuses, compromising their ability to clear mucus and increasing the likelihood of infection. Structural problems. Structural abnormalities within the nasal passages or sinuses, such as nasal polyps, septal deviations, or narrow sinus openings, can impede proper drainage and ventilation. This obstruction creates stagnant mucus pools, providing an ideal breeding ground for pathogens. Weak immune system. Individuals with a weakened immune system, whether due to underlying health conditions like HIV/AIDS or autoimmune disorders, or as a result of immunosuppressive medications, are more susceptible to sinus infections. A compromised immune response makes it harder for the body to fend off invading pathogens, allowing infections to take hold more easily. Later, we will talk about home remedies and treatment options to manage sinusitis at home. But first, let us learn and recognize the most common symptoms to watch out for in sinusitis. Runny nose or rhinorrhea. This is characterized by the discharge of clear, yellow, or green mucus from the nose. The consistency and color of the mucus can vary depending on the severity and duration of the infection. Stuffy nose or nasal congestion. This occurs when the nasal passages become swollen and inflamed, making it difficult to breathe through the nose. This sensation of blockage can range from mild to severe and may alternate between nostrils. Facial pain or pressure. Individuals with sinus infections often experience discomfort or a feeling of fullness in the face, particularly around the cheeks, eyes, forehead, or bridge of the nose. This pain or pressure may worsen when bending forward or lying down. Headache. Sinus headaches are typically characterized by a dull, throbbing pain in the forehead, temples, or around the eyes. This pain may intensify with movement or changes in atmospheric pressure. Postnasal drip. Postnasal drip occurs when excess mucus produced by the sinuses drips down the back of the throat. This can lead to throat irritation, coughing, and a sensation of having a lump in the throat. Sore throat. Inflammation of the throat may occur due to irritation from postnasal drip or direct infection of the throat tissues. This can result in pain, scratchiness, or difficulty swallowing. Cough. A persistent cough may develop as a result of post-nasal drip irritating the throat or due to inflammation and irritation of the airways caused by the sinus infection. The cough may be dry or produce phlegm. Here are some recommended methods to alleviate sinus pain and pressure at home, which are known to help in preventing a mild to moderate sinusitis developing into a severe condition that would require oral antibiotic treatment. Warm compress. Applying a warm compress over the nose and forehead can help ease sinus pressure and discomfort. The warmth from the compress helps to soothe inflamed nasal passages and sinuses, promoting relaxation and improved circulation. To make a warm compress, soak a clean cloth in warm water. Wring out excess moisture and place it over the affected areas for 5 to 10 minutes. Repeat as needed throughout the day for relief. Decongestants. These are medications that help reduce nasal congestion by shrinking swollen blood vessels in the nasal passages, allowing for improved airflow. They come in oral or nasal spray forms and can provide temporary relief from sinus congestion. It's essential to use decongestants as directed and avoid prolonged use to prevent rebound congestion or other side effects. Saline nasal spray. These are non-medicated solutions made of salt and water that help moisturize and flush out the nasal passages. They work by thinning mucus and clearing nasal congestion, making it easier to breathe. Saline nasal sprays are safe for use in both adults and children and can be used multiple times a day as needed to alleviate sinus symptoms. Steam inhalation. Inhaling steam from a bowl of hot water or a steamy shower can provide immediate relief from sinus congestion and pressure. The warm, moist air helps to loosen mucus, soothe irritated nasal passages, and promote drainage from the sinuses. To inhale steam, fill a bowl with hot water, place a towel over your head to create a tent, and lean over the bowl, inhaling deeply for several minutes. Alternatively, taking a hot shower can also provide similar benefits. So, you did everything you can to manage your symptoms, but you are not getting better. Now what? Knowing when to seek medical care for sinusitis is imperative for proper management and to prevent complications. Here's when we recommend you to seek medical provider. Severe symptoms. If you experience severe symptoms, such as intense headache or facial pain, it's essential to seek medical attention promptly. Severe pain may indicate a more serious underlying condition, such as a bacterial infection or sinus blockage, that requires medical intervention. Symptoms that worsen. If your symptoms initially improve but then worsen over time, it may indicate a complication or secondary infection. For example, worsening facial pain, persistent fever, or increasing nasal discharge could signify a bacterial sinus infection that requires antibiotic treatment. Persistent symptoms. If you have symptoms that last for more than 10 days without improvement, it's advisable to consult a healthcare professional. Persistent symptoms may indicate that the sinus infection is not resolving on its own and may require medical intervention, such as antibiotics or other treatments. Fever duration. If you have a fever lasting longer than 3 to 4 days, especially if it is accompanied by other symptoms, such as facial pain, headache, or nasal congestion, it's important to see a doctor. Prolonged fever may indicate a bacterial infection or complications of sinusitis that require medical evaluation and treatment. History of recurrent infections. If you have a history of multiple sinus infections in the past year, it's advisable to seek medical care for further evaluation and management. Recurrent sinus infections may indicate underlying issues such as chronic sinusitis or immune system dysfunction that require medical attention to prevent future episodes and complications. I promise to tell you why most medical providers like me would not sort to oral antibiotic right away. I usually recommend a watchful waiting or delayed antibiotic prescribing. And here is why. Antibiotics has many side effects that could give you harm than good when they are not needed. Most sinus infections usually get better on their own without antibiotics. When antibiotics aren't needed, they won't help you, and their side effects could still cause harm. Side effects can range from mild reactions like a rash to more serious health problems. These problems can include severe allergic reactions, antibiotic-resistant infections, and Clostridium difficile infections, which causes diarrhea that can lead to severe colon damage and death. Remember, you can also help prevent sinus infections by doing your best to stay healthy and keep others healthy. Clean your hands, receive recommended vaccines, such as the flu vaccine and pneumococcal vaccine. Avoid close contact with people who have colds or other upper respiratory infections. Don't smoke and avoid secondhand smoke. Use a clean humidifier to moisten the air at home. There you go, health warriors and advocates. Feel free to leave your comments below and check out our other videos for more valuable insights into health and wellness. Your feedback and engagement are highly appreciated as we strive to provide you with informative content to support your well-being journey.